Good morning, everyone. I'm Michael Brunt, and as SAGES president, I would like to welcome you all again to Nashville and to the 2015 SAGES meeting. I hope you're enjoying the meeting so far. Aurora Pryor and Michael Holtzman put on a fabulous program, and I'm really excited about the keynote lectures that we have scheduled this week. It's my pleasure to welcome you to the first SAGES Humanitarian keynote lecture. Beginning with the International Relations Liaison Group that SAGES started in 1997, which became the Go Global Committee in 2007 and now Global Affairs, SAGES has invested a tremendous amount of time, energy, and dollars into efforts to impact surgery globally. And I thought it would be timely for our society to hear about some of the many accomplishments of this group. In addition, this lecture is also an acknowledgement of the incredibly generous support of our global and humanitarian efforts by the donation from Dr. Pan. To give this inaugural talk, I've asked Dr. Horacio Asbun, who's chair of the Global Affairs Committee of SAGES, a position which he has held since 2009. Dr. Asbun is professor of surgery at Mayo Clinic College of Medicine, chairman general surgery, and co-director of hepatobiliary and pancreas program at Mayo Clinic in Florida. Dr. Asbun's held a number of leadership positions within SAGES in addition to chair of the Global Affairs Committee, including co-chair of the Safe Lap Cholecystectomy Task Force, past chair of the Ed Resources Committee. He's been a member of the SAGES Board of Governors for the past several years and will join the Executive Committee of SAGES as Vice President 2 days hence. Dr. Asbun is a member of the Executive Council of the AHPBA and Editor-in-Chief of the American College of Surgeons Multimedia Atlas of Surgery. He's authored over 190 peer-reviewed manuscripts, book chapters, and surgical videos. He's been invited as a guest speaker throughout the world on every continent and has served as director of faculty in over 65 national and international minimal access surgery courses and surgical meetings. He's received multiple awards as well as honorary fellowship in a number of international surgical societies. Dr. Asbun is a master laparoscopic surgeon who's taught laparoscopy throughout the entire world and has led SAGES through an expansion of our global outreach. His talk today is entitled Global Surgery, Leveraging Laparoscopy to Improve Overall Surgical Care. Dr. Asbun.
Thank you very much, Mike, for that kind introduction. I don't think that I need to explain what an honor is for me to give this lecture, and I owe it to you, and again, I thank you for it. I have no disclosures, financial disclosures, but yes, I will be biased because of my passion for global interactions and exchange of knowledge, as well as the fact that I'm humbled by the dedication and commitment of the Global Affairs Committee members. What is my role today? As I see it, my role is to represent the members of the Global Affairs Committee to the rest of the SAGES constituency. I need to demonstrate their hard work, commitment, and passion. I will give you an update on the current activities and accomplishments, some of the current achievements and accomplishments, and I will try to convey to you that it can be done well, all of this, and still have fun doing it. What is the mission statement of the Global Affairs Committee? It's promote global collaboration and exchange of knowledge to optimize patient care. But before getting into more detail, let me digress a little bit. Let's talk about globalization. As Neil Ekania, CEO of Infosys, stated, the playing field is being leveled. He said so on an interview by Friedman, who wrote the book that many of you are familiarized, that's called The World is Flat. A book that after I read, I thought the philosophy of it applies very well to what we do globally. Globalization occurred because there was a convergence of several technological and political forces. There have been multiple forms of collaboration that arise on the early 2000s, and above all, there have become little regard to geography or distances. Globalization occurred because of flattening. Flattening is a process by which individuals, as well as companies, become empowered through the process of globalization. I want you to grab the concept of empowerment of the individual, a concept that I'll be coming back over and over during the lecture. What were the flatteners described by Friedman on his book? Globally are described on the column on the left. In surgery, let me propose to you the flatteners that I think happened. Laparoscopic cholecystectomy in 1988. I do believe that the revolution of laparoscopic cholecystectomy within the field of surgery can be equated to the fall of the Berlin Wall. Why? Because the individual surgeon was empowered. Above all, there was a challenge to the traditional surgical principles. There was a completely new skill that you have many venues now to learn from. There was a consumer demand, and obviously there was an enormous benefit to the patient and society. How could we leverage laparoscopy to improve overall care? Well, just by introducing a completely new technique to a fertile environment. When you do so, if you do it well, you're going to also introduce concepts as safety, how to attain it, outcomes, autonomy, and knowledge sharing. Again, you're empowering the individual, but by leveraging now what the individual is learning, you also empower a community. Let me give you an example on a smaller scale. We will be giving you examples on a larger scale. This is Zawadi. She is a scrub nurse back in Tanzania, who Allison, who's in our audience and a strong participant in our committee, met. She trained Allison. She trained Zawadi, and probably Zawadi trained Allison too. She tells me that she was quite surprised when Zawadi was learning about how to use these instruments that have been boxed, brand new for several months, and he didn't know what to do with it. The excitement on her face is what touched Allison. But the most important thing is, if you fast forward a couple of years, now Zawadi did a community outreach and taught the community what laparoscopic surgery was. She wrote to Allison on an email a statement that to me summarizes the empowerment of the individual and empowerment to the community. Thank you, Allison. I think we're going to meet our patient's desire. Let's go back now and talk a little bit about the international proctoring courses. Those are the laparoscopic cholecystectomy courses and basic laparoscopy courses. Let me give you a little bit of the history. All of this started, at least in the form and the format that we did it starting in 2007 with Medical Training Worldwide. Medical Training Worldwide was a non-profit organization that Ramon Berger, Tom Archer, who is an anesthesiologist, and myself founded in 1995. Teresa Sevito was our administrative assistant, completely in volunteer work. Obviously, at that time, we didn't have a concept of budget. We hadn't even started a nonprofit, and we were buying very expensive French champagne. The goal at that time was to train local surgeons, not just to go and do the surgeries, train them in how to do the procedure. Then we decided to create a teaching curriculum and how to process. We were very successful in Nicaragua, Bolivia, and Peru, but only for a period of time. We realized that for sustainability, you needed to do much more than that. We had a great team of physicians, but we had very limited administrative support that didn't allow us to grow. And that's because we were younger and we were busy on our own careers. I have to credit Ramon Berger. He kept this running because he kept all the paperwork running and he kept all the organization. We just were there to have fun while we were doing the things. Problem is that in 2007, we decided we may need to close it because we couldn't sustain it any longer. Mark Pleitman, one of our heroes, came up with an idea. Why don't we talk to SAGES? Maybe they're going to be interested, and with them, we can go anywhere. The idea was great. I was just hesitant if that was going to work or not. We presented it to Queen Mother and Queen Daughter. We were lucky. They jumped at the idea. They saw the vision. They lobbied it to the leadership. and it got accepted under the International Relationships Task Force that was led at that time by Raul Rosenthal. Raul did a great job. He not only embraced it, but he let it grow. He let it grow with independence and without any ego. That helped to start the adventure of what became the Go Global. This was the initial Go Global dinner. You can see that Queen Mother and Queen Daughter didn't allow us to buy the champagne. Above all, though, our administrative support changed significantly. JQ. What we would have done without JQ. JQ has been there for every week or every other week conference calls for several years now, and she helps us put all our thoughts together and make things happen. The Program of the Americas became Go Global. Nothing of this would have been possible without the support of our presidents. At the initial concept, when all of this started, later when the task force became a committee, then when there was a vision of what this should be within the realm of SAGES. Infusion of humanitarian work based on her own experience of the missionary work that she had been doing for many years. The vision of how do we make this work from the financial point of view, trying to also bring FLS and strengthening bonds with other societies. Reorganizing every international activity to come through global affairs. In that way, we can avoid repetition of efforts. Expanding FLS and supporting any activity of the global affairs. And Mike, we're here because you want us to show what we're doing to the constituency of SAGES. You have been an avid supporter and you have shown the passion, and the Global Affairs Committee, thank you for it. I don't know if Brian is in the audience. Yes, he is. I don't know what are you going to do, but if you just realize I publicly committed you to continue supporting the global affairs. Let's talk a little bit about outcomes. Our first course was a follow-up course from Medical Training Worldwide that we had done in Peru in 2007. You can see here that in 2007, at that institution, there had been only 42 cases done. By 2012, 84% of the gallbladders were done laparoscopically. Not only that, but the number of gallbladders done at that institution grew 438%. We followed outcomes, something that was very difficult for us to do before. Thanks to SAGES, we were able to follow outcomes. You can see the conversion rate dropped from 5.6 to 0.6 in 2012. And then the common bile duct injuries went from 2.7 to 0 in 2012. This is a major accomplishment, knowing that this was in the middle of nowhere in Peru. But that didn't stop there. This is some of the teams. Ted Truss has been a fantastic member of our committee and has gone in many trips, as many of the other members are. This is our local champion. The local champion, Dr. De Dios, decided that was not enough. He grabbed the concept of FLS, and even though they are not certified because they are not allowed, he started doing testing. He invited people from other regions in the country, and he expanded this to other countries that come to him now, and he has established a training center with full support of the government. Let's go back to Mongolia. Laparoscopy was introduced in 1994. By 2005, though, only 2% of the gallbladder surgeries were being done laparoscopically, and only in the capital. SAGES and the Swanson Family Foundation, through Ray Price, decided, hey, if we work together, we may be able to help expanding laparoscopy in Mongolia. By then, the Go Global program was very well established. This is the map of Mongolia, and these are the trainees in a 6-year period, all of them capable of doing laparoscopic cholecystectomies. Dr. Sergelen, that it is in this prior picture here, with Mike Maroon and Ray Price, she is our local champion. She has been fantastic. She provided this map that summarizes what SAGES can do with good support. This is Mongolia. The red areas are places that SAGES along with the Swanson Family Foundation, have gone to teach laparoscopic surgery. Before, there was nothing in those places. These red areas expanded to the green areas. These surgeons taught in all of these green areas. And now, in 2015 and 2016, this program has caught attention from the Ministry of Health, and they will finance the rest of the training. Today, over 80% of laparoscopic cholecystectomies in the whole country of Mongolia are being done laparoscopically. In 2005, it was only 2%. This is a significant achievement. I propose to you, do we even know if 80% of the cholecystectomies in the United States are being done laparoscopically? All of this because of the effort and support of the SAGES group. Let me introduce to you Raise Price Fun Club. How did we leverage laparoscopy now to improve global care in an area like Mongolia? Many improvements happened that were parallel to the development of laparoscopic surgery. At the end, improved medical and surgical care for the entire surrounding rural population, local referral hospital was the result of what we was started. Ray Price received the Friendship Medal Award, that is my understanding is the highest civilian award given by the Ministry of Health. This is the Minister of Health of Mongolia. Ray Price and Mike Maroon became the 4th and 5th international members of the Mongolian Society of Surgery. Ray tells me that Mike's motto in all of these trips is adapt and overcome. I don't know if that motto was thought when he has to put this type of hat. But let me talk a little bit about adapt and overcome. Let's go back to Allison again. She sent me this quote. This was when the elevator in a Mongolian hospital broke down. The patient was driven down the stairs by the family and doctors. But what I really like is she says, things are often broken, but somehow we always manage to get things done. Now, sometimes you cannot adapt. Cody, who is one of our scrub techs, couldn't adapt to the size of the scrubs of the Mongolian people. He needed to bring it from the United States. Now, Cody has been inspired by these trips, and now he is a third-year medical student. What are the characteristics of a successful program? You have to have a very planned application process, very well defined. These are the important things within the application process. But above all, sustainability is the one that we put most attention. 5 top criteria for sustainability. You have to have a local champion. And by a local champion, I mean a champion within SAGES and a champion locally in the country that you're going. The programs more so successful have been because of that. The local people have to have some skin in the game. Early on with Ramon, we learned that we were very enthusiastic, but if we gave everything for free, we would arrive to the country, they didn't have the patients that they had promised, and many times they didn't even come to the lectures. We decided they need to spend on something. Therefore, we asked for local support, lodging, transportation, or meals, even if it is sleeping at their own houses. Meals sometimes are pretty darn good, though, as these ones here. Sometimes are extraordinary. I'm not going to tell you where this meal was provided, because I'm sure we're going to have a flood of applications to go to this site. Communications. It is important that they communicate directly with the SAGES office. In that way, we can assess the logistics, and there's only one channel of communication. Outcomes reporting and team approach are obvious. We have the do's and don'ts, but above all, we need to make sure that we do not patronize. These are people that we learn from. This is my personal experience. Let me diverse a little bit. The donkey treatment of sigmoid volvulus. I used to go to a hospital in the middle of the Andes where they have a very high incidence of sigmoid volvulus. And they keep telling me that the patients were treated with a donkey. I couldn't understand why. What were they doing? I immediately told them that is wrong, because I saw patients that came with perforations 2-3 days later. Eventually, on my third trip, I decided, let me go and see what they do, because there were some people that argue with me. They put the patient laying on his belly on a donkey, and they spunk the donkey, then donkey starts jumping, pressing the belly, and yes, some of the patients devolvalized. Therefore, by me being educated by the way how they treated the sigmoid volvulus, I decided that we needed to compromise. And rather than demanding that everybody travels all of those kilometers to come to the hospital, we decided just bring them if the symptoms don't resolve immediately after the donkey treatment. I got educated. That means mutual respect, education, and appreciation of the local conditions and beliefs. We should not patronize, and when we gather faculty, it's very important that we choose and see all of this. To be a faculty, you have to fill up a very stringent application process. You have to adapt to unusual environments. Some things very simple. First time I used these operating shoes, they gave it to me. The problem was not the type of shoe. The problem is that they had blood spots on it. You cannot offend the people. You just need to wear them. Guess what? My toes have not dropped. I still have them. If they don't have water, you just adapt. This is more serious, but you need to be careful not to offend the people. This is a cholangiogram. If you can see here, this is the cholangiogram machine. This is the technician. The surgeons have no problem. I'm here trying to get away as far as I can from the x-ray. When I saw this, it was the first time I was seeing a cholangiogram in that country. That's not the moment to tell them why or if that's dangerous. That's the moment to say, okay, let's just do it and you talk about it later. You need to work hard. This is our team in Philippines. We did 19 surgeries. We trained 2 surgeons over 4 days. This is the team. We were all tired, resting in the floor between cases. Dr. Ian Soriano found a better place to sleep. The end result of this course were 202 patients in 5 years, and according to their results, 1 bile leak and 3 conversions to open and 3 umbilical hernias. We can work hard, but also play it too. I learned how to ride a rickshaw and how difficult it was to actually carry the rickshaw driver, or through a patient, be able to be a gardener in the gardens of the Taj Mahal, or to drive the most luxurious car I have ever driven. Why is this a luxurious car? Because Mercedes-Benz and Rolls-Royce did a joint venture building this car. What did we learn? We learned that we have to stop these courses when the goals are reached. We encourage expanding the training by local faculty. We support it through telepresence and telementoring. And the continuing of outcomes reporting is a must, at least for 5 years. This is Alan Okranek, another of our heroes. He quietly gets things done. He has introduced us to telementoring and telestimulation. And in his own words, it reminds us that we now live in a world where we can educate without borders, little regards to distances. Alan has done a tremendous job helping us with not only the telementoring, for many aspects of the committee. Let's talk a little bit now about the Haiti surgical curriculum. The university facilities in Port-au-Prince were destroyed after the earthquake, and changes in the faculty left a void in surgical curriculum teaching. Then, with Paul Severson, we came up with the idea of what can we do to try to help them. We decided to see if we can do teleconference transmission of surgical lectures by US faculty. It took over 2 years to plan and get the support of the local authorities. We then did 8 pilot lectures. Again, all of this with the support of the board and the SAGES leadership. We did a reassessment of those pilot lectures, and now there have been 21 lectures. All of this started on the fall of 2014. Therefore, trying to follow this core curriculum, 18 speakers from 13 institutions. Usually there is 1 to 5, but up to 9 centers that connect at the same time. Within this, all 3 residency training institutions, and the most we have had have been 100 attendees. There are a lot of things that we can build on this, and we're learning through the process. This is the first group, and as Paul states, they were quite proud of the highly successful SAGES surgical curriculum. This put Paul on the spot. And as he states, after 27 years, the Ministry of Health looked at what he was doing and gave him the Honor and Merit Award in March of 2014. He states, quote unquote, many of us owe a debt of gratitude to SAGES. Among other heroes, we have Mike Evans, who is there for every conference, and he has been developing platforms of transmission. He states our friends in Haiti are hungry for education, and I'm proud to help them learn from the remarkable doctors of SAGES. How did we leverage laparoscopy to improve care in Haiti? Again, same things, but a little different theme. We were able to engage the public health, something that wasn't there. Broadband connections, which are extremely expensive in Haiti, became a reality. The surgical community is working together better with more common goals in a country that is characterized for chaos and lack of cooperation. We introduced the SCORE surgical curriculum. Paul Severson is going to pay out of his own pocket to give the SCORE surgical curriculum for next year. I'm looking for volunteers for the following year, because if I don't find a volunteer, I'm going to have to do it. What are other GAC activities? Let me just go through quickly, because from time constraints, I cannot tell you all the other things we do. We do the annual meeting webcast. We owe this to Nathan Zundel, my current co-chair and also recipient of the International Ambassador Award by the Foundation yesterday. Nathan has done a great job initially bringing Latin America to SAGES through the annual meeting webcast. Later on, Brant Oetschlager took over. But basically, certain sessions of the SAGES Congress have been transmitted over 35 countries in Latin America, Asia, and Africa. Furthermore, when we partner with the US Armed Forces and the Royal Armed Forces to take this to our military, this has been broadcasted now to Iraq and Afghanistan and has engaged over 8,000 surgeons worldwide. Again, everything starts small with an idea, and you have a brilliant group of people in the Global Affairs Committee and on the other groups of the leadership and constituency of SAGES, and we can accomplish these things. The International Presentation Awards, those are the best international papers among the ones that have been accepted to the meeting. We have given over 35 awardees. Initially, this was supported by industry, but then when industry money dried up because of the conflicts of interest, now the SAGES Foundation took over, and they are funding all of this, thanks to the SAGES Foundation. The Academic Exchange Program. This came out of the negotiations of Steve Schweitzberg, who has been a champion with China. We decided to host junior and mid-level faculty into our own institutions for a period of 2 months, and then for the senior faculty to come in exchange. Within the relationships with other societies, ALASE, EAS, IPEC, JACES, Mongolian Society, China, COSEXA, all of these are societies that now have bonds with SAGES, societies that are coming to be part of our family. PALS is also a society that we have interacted. There are many societies that we interact at different levels, and we're planning to interact more. We have had joint sessions in different countries between SAGES and the other societies. And the academic exchange program with the Chinese has started. We have had now 4 members for 8 weeks, hosted at centers in the United States. We're in the pilot period, and we will expand this to other centers. I want to thank Jeff Hasey. He has been my co-chair for many years, very much a worker bee, and always there for our conference calls, even when I'm late on the calls. Sam Finelson has helped us do a lot of the translations. He has been in China, Tanzania. He works on outcomes and has helped us put together all of the outcomes. Adrian Park. Adrian Park is passionate about Africa. He has shown me what true passion and perseverance is. It doesn't matter what happens. Let's just do it. We need to help them. Adrian is a person that I saw his heart broken last week, even though I was on the line, because we had to cancel our trip that we were planning to go to Nairobi because of the attacks that happened by the terrorists that killed 147 people. He keeps telling me we cannot cave to the terrorists. I agreed, but we had to, because we couldn't expose our group to that type of risk. Adrian sent me this quote: "He is no fool who gives what he cannot keep to gain what he cannot lose." He tells me that he's guided by this principle. I'm going to finish with some quotes, and I'm sure that I'm going to forget many of our members of our committee, and I apologize for that. I'm going to thank to all of those that I haven't mentioned here, because we have a very big group. Some of the quotes from Susan Yoder. "The Go Global adventure is about creating a team that unites people from vastly different cultures in pursuit of excellence in patient care. While that happens, the team of fun and friendship just happens." Peggy Frisella, she started our Allied Health Personnel Group. "The friendships I made on this trip will last a lifetime. Life is short, and every minute needs to count." Passion. Passion generates so much momentum that results in improving training and infrastructure at the very place it's needed the most. This is Thomas McIntyre. Thomas McIntyre, it's a really cool guy. He doesn't like the limelight. Same thing that Mark Pleitman. These are people that just work and do the work. I have not known why he has so much dedication when he goes to Haiti. I don't know if I could do this. Hours and hours teaching these residents on a box. I mean, many of us go, and that way we can come back with a cool story, a pickup line for our wives or girlfriends. What am I going to tell them? I was sitting watching people do it on a box? That's not going to work. Now, I'm wondering if maybe there's something else going on. As you can see on the table, I don't know if he may be selling Apple computers with his wallet there in Haiti. Trust and independence. This came from Ian Soriano. In that short span, they had gained our trust in performing the surgeries independently. These are the two, with myself and Ian Soriano, the two proctors. Now they are doing it by themselves. Unfortunately, I get bored by not doing anything, and soon enough we were fencing while they were doing the surgery. I'm just going to finish by saying, why do we do this? Lombardo, that is a Price's group, did a survey, and you can see the clear things: service, share of skills, travel, etc. We all have our reasons. But the reality, I'm a strong believer that we do this because we want to make a difference. We really want the place where we go to change for the better. When you come back, you look back at the place and you say, yes, it has changed for the better. How much for the better? It's really not important, because that's on the eye of the beholder. The important thing is that you affect a change, that it is on the right direction. I propose to you, let's all continue doing it. Thank you very much for the opportunity.
Horacio, that was absolutely inspirational, both the message you delivered and the work of your group. I have a plaque that I would like to present to you. It begins with a quote from Martin Luther King, Jr. "Life's most persistent and urgent question is, what are you doing for others?" SAGES 2015 Humanitarian Lecture, Horacio Asbun, presented by SAGES. I'd like to ask if those standing over in the aisles by there are lots of seats, so